guys, my name is Allie Liggett. I'm a contributor with Kansas City Mom Collective, and I'm here with Dr. Roger De La Torre of HCA Midwest. He is a board-certified bariatric surgeon with HCA Midwest, and he's had experience with bariatric surgery, working in the field for more than 15 years. I myself am a patient, and I had surgery here with him 6 months ago. So I'm here just to kind of talk about my experience as a patient and get more insight from him as a surgeon working in the field for so long. So, like I said, I'm a contributor here with Kansas City Mom Collective. I have a 2.5-year-old daughter. I had the surgery 6 months ago, and having the surgery as a mom with a little one at home was a difficult recovery, but I feel like if you're prepared and you kind of know exactly what you're looking at, it'll make things easier. So hopefully you can share some of that with us. Our first question here, what are some of the options for people that struggle with obesity and just some ways to get help?
So the options are actually quite a number. There are quite a number of options, ranging from having a balloon placed temporarily in your stomach. This is done endoscopically. There are no incisions. It's left in for 6 months, giving you the sensation of fullness. And at the same time, a dietitian can work with eating habits and the like. And then 6 months later, it comes out. Hopefully, the weight loss that does occur stays off, because now a person is used to eating differently and managing themselves differently with exercise and so forth. That's one option. Then there are a variety of medical options, and we have nurse practitioners that can prescribe a variety of medication for weight loss. And then when you get to the surgical level, there are, again, a number of options depending on how much weight a person needs to lose, how bad their comorbidities may be in terms of diabetes, high blood pressure, sleep apnea, and the like. And what a lot of people don't know is that there are surgeries that are linked with a resolution of type 2 diabetes. So when I was much younger, if someone were diagnosed with type 2 diabetes, they were told, here's some pills, maybe some insulin. You have to watch what you eat over the next several decades and hope you don't lose your eyesight, your kidneys, or your legs. Now we can look at them and say there's an operation that has an 86% reversal nationwide of type 2 diabetes, meaning you're off your medicine, all medication, and your blood sugars are normal. There's even one that's more dramatic, that it has a resolution that's over 90%. And again, depending on how much weight loss, whether they have the comorbidities, whether they have reflux, that will dictate which one of the 3 main surgeries that are out there that we can do. And one of them can even be done endoscopically, so again, there's no surgery. There's no incision, I'm sorry.
Yeah, so when I came for my initial consultation, I was presented with those options, and given my specific circumstances, we kind of narrowed it down to 2, and then basically you guys let me kind of mull it over and decide, get kind of pre-approved insurance-wise for both, but ultimately I went with the Roux-en-Y gastric bypass for both the comorbidities, the long-term success rate, and what was going to work best for me. So that's the decision that I made, but got all the information here and was able to kind of mull it over and decide for myself. So
that operation, although now done laparoscopically with little tiny puncture wounds, or robotically again with little tiny puncture wounds, has actually been around since the mid-1950s. Obviously back then it was done with a big incision, and someone was in the hospital for a week after surgery. It's completely different now in how it's done, but the operation itself involves the same steps and has provided tremendous weight loss, and again, as I mentioned, resolution of diabetes, high blood pressure, and those sorts of things.
Yeah, my recovery, I was in the hospital for about 24 hours after surgery, and I think that can vary between 1 or 2 days on average. But I did everything they asked me to do after surgery, walked around, drank my water, and was out back home within 24 hours.
Right. And you had a child to get home too, so
yeah,
you were
I was
very motivated.
Anxious to get home. Not, the hospitality is great, but I was happy to get home.
The average return to work, and this is if you take blue collar and white collar workers and sort of lump them in as one, the average return to work is about 10.2 days. So depending on the type of work you do, I tell people use the 10 days as sort of a rough guide.
Yeah, for me, I work in an office. I had the surgery on a Friday. I took 1 full week off work, and then was back at work in an office sitting down, but that was 10 days was about right for me. Another question here is, what are some other just simple lifestyle changes that we can make right now before, even if we ultimately decide to have surgery, that will make the surgery go better and post-surgery life go better?
So before surgery, you recall we had you on a restricted diet for a short period of time, just a week. And that's because it's been shown that that type of a diet can help reduce the size of the liver. So in the surgery, we have to lift the liver to get to the stomach and do the things that we have to do. By putting you on this restriction or this restricted diet, we get the liver to shrink, some say up to about 1/4 of its size, and obviously that makes it easier to lift. You're going to, want to exercise and walk. That's key after any surgery, and anyone who struggles with obesity has a higher chance of clots in their legs and things after any procedure. So we want you to get used to that, and we encourage you, and you were great about it, to get out of bed and walk in the halls, even immediately after, as soon as the anesthesia wears off and you're able to.
Yeah, they have you walking to your room from they wheel you up and then kick you out of the nest and have you walk into your room, just to start you off on the right foot. So they're not kidding when they say to walk. So what have you found that bariatric surgery can help with for people that have tried diet, they've tried exercise? What do you think the difference is? Is it just the physical restriction?
So it depends on the operation. All 3 of the main operations, and by the 3 I'm talking about a sleeve gastrectomy, which is very popular. And if you go on the web, there are people who talk about sleeve gastrectomy. Again, that is purely restricted, where a portion of your stomach is taken out. It's called a sleeve, by the way, because the stomach is like a football. But after the procedure, it's tubular and it looks like a man's shirt sleeve with a French cuff. So that's why it's called a vertical sleeve gastrectomy. So it reduces the size, meaning the volume of food you eat is going to be less. It removes the most distensible part of the stomach, the stretchiest part, that thing that after a Thanksgiving meal when you're like, oh my gosh, I can't eat another bite. And then, hey, Aunt Betty's here and she's got pumpkin pie, your favorite. Well, you're able to eat that bite. It's because of that stretchy part, and that's being taken out. And then there's a hormone called ghrelin, which is made in the part of the stomach that's removed. And that hormone is one of the things that tells your brain you're hungry, you need to eat. And so when that's taken out, you lose that signal. In your procedure, no part of the stomach is taken out, but you're left with a tiny pouch that when you eat a smaller volume than before, you now feel just as full. And then, again, ghrelin is not stimulated to the degree that it was before the surgery, so you have that and a small bypass component. The 3rd main surgery is the duodenal switch. So that we talked about sleeve gastrectomy, you had a Roux-en-Y gastric bypass, and then there's the duodenal switch, which at one time was reserved for the really super obese, my 600-pound weight loss people, or was done actually outside of the U.S. It really wasn't done that much in the U.S., but has gained popularity within the last few years. And we can take really heavy people and get them to lose a tremendous amount of weight by mostly, again, having a reduction in the volume that they can eat, again affecting ghrelin by taking part of the stomach out, and then a tremendous amount of bypass. And that's the one that's been linked with greater than a 90% resolution of type 2 diabetes.
Yeah, so for me it was a combination of not only being physically restricted in what my new small pouch could hold, but again, those hormones that stimulate hunger, with those not in your body either at all or as much, you're able to kind of reset and retrain your mind to listen to hunger cues, which actually at first was quite difficult. The first 6 weeks of my recovery, I couldn't hardly eat at all, and I think it was a combination of not only the smaller stomach, not only the recovering from major abdominal surgery, but nothing was telling me I was hungry. And you have to eat, you have to get some calories in to recover. So for me, that was the biggest struggle and the biggest surprise, was that I wasn't hungry at all, but you still had to push past that to be able to heal and do well, recovery from the surgery. So that was something he had told me, I was told, but until you experience it, it's definitely different. So for me, like I said, the recovery, I was at home within a day, back at work within a week and a half, but the first 6 weeks of recovery, pretty limited. I don't know if you want to talk about that. Especially being a mom, I couldn't lift more than, was it 20 pounds? Or...
So it's funny you say that, because I know our nurses, when you leave, put a restriction on it. I remember patients coming in saying, I was told I can't lift anything more than heavier than a jug of milk. I don't have that restriction, and so I don't mean to criticize the information or counter the information you were given at the hospital before you left. Quite frankly, I wait about a week or so. Mm-hmm. And after a week, if it doesn't hurt you to lift something or do something, I say it's okay. Even swimming. Now, the one restriction I do agree with is if you have these incisions that have to heal, it's not fair to use a pool where there are people around you, and here you are coming in with these incisions using the pool. So I put a good week to 10 days on submerging the wounds either in a tub or a hot tub or in a swimming pool. But other than that, after a week, I really don't have weight restrictions.
And it's laparoscopic or
right.
robotic, so these are really small incisions that, obviously need to heal, but are not giant open wounds, so they do heal. I felt like I healed very quickly. So
the restrictions made sense in the days of the big incision where you had this 10-inch or 12-inch incision on your abdomen, and the fear was if you lifted something heavy, the sutures might tear, and that would be a disaster. But now, the biggest incision really is about the width of the end of your thumb, and the smaller incisions are the width of your index finger. And to think that if you lifted something, everything's going to fall apart, it really doesn't hold as much anymore as it at one time did.
And another thing with my recovery is I involved my 2-year-old. I had her take me on walks around the house, get me moving, any way that we could bond when I wasn't able to really lift her up and play with her hard while I was recovering and doing all of that work. So I involved her as much as I could, and she knew Mama had surgery on her belly, was very gentle, and she was just 2. So there's definitely ways to incorporate your kids and make sure that they aren't scared, but know that you've got to heal. So for me, and I've written more in a blog that'll be out next week, but this was just the beginning for me. Weight loss surgery is just a tool, so we learn the ways that it can restrict your physical, what you're physically able to eat, the hormonal aspect, but also, and a requirement of the surgery is you get psychological clearance from a therapist. And I encourage anyone that's thinking to do this, don't just do the one appointment and get signed up. I go to therapy, work through those issues. We didn't end up overweight or obese in a day in one surgery. It's not going to fix that. So until you really work on your mindset as well, the surgery is just the surgery. So They, here at Bariatric and Metabolic Specialists, that's part of their surgical pre-checklist, is to make sure you have that psychological clearance as well. And I encourage everyone to just continue to work through those issues before surgery, after surgery, and always.
Yeah, it actually is a mandate. We are a center of excellence here and we have to follow the ASMBS guidelines, and one is a psyche eval before, to make sure that you're able to comply with the diet and you're willing to do your part and not let the surgery be the end all of your weight loss journey.
Yeah, it's definitely not the end. For me, it was the beginning. I'm 6 months post-op next week, so I'm not done. I'm not where I want to finish. But like I said, I do cognitive behavioral therapy. I started at about 3 months post-op, started going to a gym, working my body as a celebration of what my body can do and not as punishment, which was a hard concept to grasp before the surgery. But I just encourage anyone who's ever thought of it. I thought about it for years before I actually came here and did it. Come here, have an appointment, have a consultation, learn everything about your specific situation, your insurance, your specific health, what you qualify for, and really think about what this could do for you, and make the choice to take care of yourself so you can take care of others. Thank you so much for your time.
Thank you. Thank you.